He was a gentleman, he was always happy, smiling, always wanting to help people.
Norman Barker didn't often need help himself, but he did 3 weeks ago after developing serious chest pains. Told there'd be a 2-hour wait for an ambulance, his family drove him straight to hospital. It was Monday tea time, during the busiest month England's A&Es have ever known.
It was packed. People were standing outside of A&E. There was nowhere to sit anywhere in A&E at all. It was impossible.
With a 4-hour wait for assessment, his mum decided to take him home.
We just got out of the hospital, out of the far end entrance, and he grabbed hold of my arm. He said, "Help me, Mum," and he collapsed.
By then, there was nothing the hospital could do for Norman. The NHS trust that runs it has offered his family its sincere condolences and is investigating, but it's little comfort.
No, you'll be here with me. If they'd done their job, he probably still would have been here.
But across NHS England, it's never been harder for staff to treat patients promptly. 469,000 people waited over 4 hours at A&E last month, more than any time since the target was set in 2004. Just over 5,000 waited over 12 hours. That's almost double the previous month. And it's not just A&E. There are a record 5.7 million people waiting to start hospital treatment, the highest figure since records began. COVID's behind some of that backlog, but people also head to A&E when they can't get an appointment with their GP. The Health Secretary announcing a new fund, though it comes from money he told us about last month, to help.
I don't think people would be surprised to hear that the cost per hour of locums has risen generally, and this package will help to cover that. But it will also help to hire in further support, clinical support, including from nurses, from physiotherapists, podiatrists and others.
But there have been warnings of falling doctor numbers for years.
We don't have the bodies. It's not about the funding or injecting the millions into the service. If the GPs aren't available, we can't provide the appointments.
The knock-on effect of that summed up in this stark warning from the Chief Medical Officer.
The winter as a whole, I regret to say, is going to be exceptionally difficult for the NHS, and general practice is going to be absolutely at the forefront of this.
If the public takes up flu vaccinations and COVID boosters, that will help, but none of it will come in time for the family of a man who had the misfortune to fall ill when the NHS was busier than ever. Rachel Younger, News at 10, Lincoln.